have that program, and Community Health Net is one of the providers of that program. There are some requirements. It's basically dependent on your income, but that doesn't mean because you have a higher income you can't get it, because if you have insurance that won't cover it, then that's another way to get those services. But please go to the CDC website for more information about breast cancer in men and women, and also the resources that are available in your community. So I said usually black women are diagnosed in later stages. So I want to talk about the different stages of breast cancer. And how many of you are familiar with the term stages of cancer? Okay. So let's talk a little bit about that. So stage 0. Can I get someone to give me an idea what stage 0 is? If you have an idea? Stage 0.
Safest.
Stage 0. Say that again.
Is it the safest one?
The
lowest chance?
So stage 0 means that it's very small.
Yeah.
And it is within the tissue or the organ that it is in. It has not spread.
Okay.
So stage 0, if you were to get a cancer, is the best stage to have a cancer diagnosed.
That's what I mean.
Why? Because early detection of any cancer is the best protection. The smaller it is, the more likely chance that we have that we can get in and take just those cancerous cells out where they're located at stage 0 and remove them from your body. You may not even have to have chemo or radiation. Those things are kind of determined by the oncologist, which is a cancer specialist doctor, who puts together a treatment plan for the stage of cancer that you have. So stage 0 means that there's no spread, it's very tiny, and it is more likely that you will be able to survive that cancer if it has not spread. So stage 1. Stage 1 cancer. This is any cancer. Any idea? Oh. So that means that there's no spread outside of the organs or tissues. It may be a little bit larger than the stage 0, but it still has not spread. So a stage is 1 because it is not small. It may be a moderate size, but it still has not spread out of the organ or tissue. And it's not considered the advanced stage. Stage 2. Stage 2 has started to spread outside and spread to the lymph nodes. And this is why some breast cancer, women who have breast cancer in men, the surgeon will go in and remove the breast tissue and also take out a couple of lymph nodes to determine how far the cancer has spread in the lymph nodes. When cancer gets outside of the area that it started in, that's when your risk starts to increase that the cancer may spread to other parts of your body. Which is why I keep harping on getting to the doctor early, sooner rather than later. Okay? So stage 3. Now we start to get into advanced cancers. It is spread to the lymph nodes, other tissues, and other body organs. It could be soft tissue organs like your liver, and gallbladder, pancreas. So these are the things that we're trying to prevent when we try to encourage people to go in as soon as you see something or feel something. And this is stage 3 is an advanced cancer. So stage 4 is the most advanced cancer. It is called metastatic because it has spread to multiple organs, and the tissue itself that had the original cancer, typically there's a huge mass there now. So those cancer cells are starting to break off and spread to other organ systems in the body, which is typically the stages 3 and 4 are when most black people are diagnosed, because we won't go in. And then you feel like all hope is lost. There's nothing that you beat yourself up. Why didn't I come in earlier? Why didn't I know about this? And the other thing, and we'll get to that, is I'm talking about family history. We don't like to talk about cancer in the family. We don't have those conversations. So stage 3 and stage are the most advanced, and 4 is the most advanced, and you have cancer pretty much in any place that it can spread to. Definitely more difficult to treat. And then there's been a lot of conversation in the news about triple negative breast cancer. And what does that mean, and how is it treated? Well, triple negative breast cancer is a very, very difficult cancer to treat. Each person that has triple negative breast cancer is typically African American women and women of color. We have receptors, estrogen, which is a hormone, and progesterone, which is also another hormone. And then we have proteins. The HER protein is the other. So when you get triple negative, it means that you have no receptors in your body for the cancer cells itself have no receptors. And so most of the medications that we use to treat breast cancer, those cancer cells have hormone receptors on there, so the medication can latch onto it and then get into the cancer cells as well. So the triple negative makes it a lot more difficult for doctors to treat because there aren't receptors there for the medication to adhere to. And so triple negative is the most advanced and aggressive form of cancer, and it spreads the fastest. And that's why it's so important, again, I keep harping on it. Get in, as soon as you feel something, say something to your doctor. So the triple negative is more likely to spread beyond the breast, and is also more likely to return after you've been treated for. And so you hear people talking about, well, I had breast cancer, I had all the treatments, and then it came back. And typically when you hear people say that their breast cancer came back, it's because they were triple negative. And they had that stage of the disease. Now, I know that all sounds very dismal, but the 5-year survival rate for triple negative breast cancer, when it has not spread, is 91%. So you can survive. Your 5-year survival rate is 91% for triple negative, but those are all the people who got in early. Because the longer it stays in your body, the more advanced and the more the cancer is going to spread to other organs, which makes it extremely difficult to treat. So I've said a lot and given you all a lot of information about breast cancer. So what I'd like to do, and I think we did this a couple of times in the last few years, is, I want you guys to talk to me, ask me some questions, and let me see if I can, respond to those questions, because I did just give you a lot of information. And it does not, I don't like to see numbers like this when it comes to talking about, my patient population. I don't like to see these numbers. And so I want to help people help themselves to be able to not be in the 3rd or 4th stage of any type of cancer. Oh, and what I didn't start off by saying, you guys fill this room up every year. The decorations are off the charts. You guys just go above and beyond to make sure that you are making people aware. And I love the t-shirts this year, tackling breast cancer. And then with the football theme on the wall outside of the lab, you have it really going on. So I want to say thank you. I want to say thank you. Because, you could just put on a little pin on your jacket or your shirt and call it a day. But you guys don't do that. You go all out to recognize and honor, breast cancer awareness month. Yes, sir.
What kind of signs to look for when a man gets breast cancer? What do you look for?
Same signs as a woman will look for. So one good thing, because you guys, your chest, your breast is attached to your chest wall. So you might look in the mirror and see if there are any differences between the two. You might see some dimpling where it looks like the skin of an orange. So the skin is going backwards, inward, instead of being out and smooth. You might see those kind of dimples. It looks like this peel of an orange. Okay? You may actually see or feel the lump. And so those are some of the signs and symptoms. Yes, you can have some blood leaking from the nipple as well. That's definitely a fright sign. Get out of there and go see somebody right away. So it's just, men just usually just push stuff off and push through it. Because, we got to get up, we got to go to work, we got people dependent on us, we got bills to pay. But you can't pay any bills if you're not here anymore. You know, if you're 6 feet under, you know, you won't be on anybody. We don't want that to happen. So I'm asking everybody, you know, within the sound of my voice, to, if you see something, if you feel something, do something about it. Yes, sir.
Within your blood work, what kind of abnormal things would you see?
So here's the thing. Most times there won't be any abnormal blood work. Typically, the abnormal blood work is in the later, more advanced stages. When you see those cancer protein cells, when you do the blood test, they start to be elevated. But someone coming in to me and just saying, you know, I feel this lump, I'm not going to run a battery or blood test. I'm going to immediately do a physical exam, write my thoughts down, what I believe is going on, and send them for the mammogram. Because that's going to tell me more than the blood test would. Because I can put in a test request for the different cancer determinants, CEA, CA191, those may be normal. Because those only elevate when the cancer advanced. So we check those when we want to determine if the cancer is getting better. Versus, you're going to have a normal count at first, unless that cancer is really advanced. And so we're going to get you into treatment right away if the cancer is advanced. Then we want to know if those treatments are working. Then we'll get those lab tests. Okay? Great questions. Yes, ma'am.
Okay, for women, at the age of 40 or family history, we get mammograms every year. For the men, they can't do mammograms. So I know, because I have a family history of it, they also do a ultrasound. Is that the only way they can detect it for the men, is the ultrasound way?
No, men can have mammograms as well.
Okay, that's what I was trying to see.
Men can have mammograms. Typically, if the lump is there and if they can feel it, it can be detected on the mammogram. Mammograms can actually, right now, the technology can detect a cancer that is a grain of sand in the breast, the size of a grain of sand. So the technology is really advanced. So if there is a suspicion in men, a breast cancer will be covered under insurance or under that breast and cervical cancer screening program. If there is a family history, you want to bring that to the doctor's attention. And I know many of you may know this, but I said this last year, year before last. Richard Roundtree was a breast cancer survivor. Shep, he had breast cancer. Yes, sir.
Compared to the Western Hemisphere, what are the statistics like compared to like in Asia or Europe?
So that's a very good question. Our rates of breast cancer, African American women, and women of color in general, no matter where they live, those statistics don't change. We just have a higher risk and a higher rate no matter where we live. So I know where you're leaning toward looking at diet. Asian women don't get breast cancer at the same levels of white women or African American women. Asian women are at the lower end of the scale as far as percentage and risk.
Are these African American women doing Eastern medicine?
So when you say Eastern medicine, you're talking about acupuncture and the Chinese therapies and things like that. And so let me make sure I'm speaking correctly. When you take an African American woman, no matter where she lives at in the world, her risk is still high. So if you go to Africa, if you go to Nigeria, you go to you look at Cambodia versus Nigeria. The women in Nigeria have a higher risk of breast cancer, same as in the United States, because they're African American, and the technology that is there is for people who can pay for it. So if you're out in the village, you aren't getting a mammogram on an annual basis.
Right.
So when that tissue is discovered, when that cancer is discovered, typically you're going to die of the breast cancer because there are literally no services. You have to go to bigger cities like Lagos. And why do I know this? Because my husband is Nigerian. And you have to go to the larger cities, and they do have larger cities, but most people, older people, live out in the villages because that's what they're comfortable in. They don't like the lights and the traffic lights and the noise and the traffic and all that. So you move us anywhere in the world, our risk is still high. And Asian women are at lower risk for cancers. Now, Asian people in general have a higher rate of gastrointestinal or stomach cancer. And our rate is lower for that.
We have a question on that.
How early should men get checked for breast cancer? Is that something a regular physical appointment will reveal? How early is, and this is going to sound mean, but some of our children, because they are so sedentary, meaning sitting around playing video games and stuff, they've gotten a little obese. So they have breast tissue, the boys. And so we start, I know I do, talking to them at 11 and 12 years old, and talking to them about making sure that if they feel something funny, bring it to them with their father's attention. So it could be as young as 11 or 12 years old for boys that are growing breast tissue. So as far as this is something a regular physical appointment will reveal, think about how many times you go to the doctor. Most people go to the doctor unless you have something really, really chronic once or twice a year. So unless you say something to the doctor, they may not even assess your breast tissue. So who is the best person to do that?
Yourself.
Point back at yourself. And you can open that pamphlet up again and it shows you how to examine your breast tissue. Right in the middle, down there at the bottom. Shows you how to examine your breast tissue. It's called self-breast exam. Women, you can do, you can do it in the shower once a month, or laying down in the bed, whatever you feel comfortable with. Men, I told you, look in the mirror, and then use those techniques. Yes.
I've heard you speak in other settings, Dr. Seabrook. Can you reiterate about going for screenings and making it an annual thing based on different things that happen in your life that mean something to you?
Oh, yeah. I like to give these like gentle reminders. If there is something significant to you, like your first child's birthday, Mother's Day, Father's Day, whatever it is, make that, maybe even your own birthday, make that the day that you're going to have your appointment for your mammogram or for your physical. And that way it's in the top of your mind. Okay, it's Father's Day. I'm going to make sure I'm taking care of myself. It's Mother's Day. I'm going for my annual. And then after that, I'm going to get my mammogram. I schedule my mammogram to be right after my doctor's appointment. So kind of keep those kind of special dates in mind. And that will keep you on top of getting those at least annual screenings. Yes, ma'am. Yes, sir. I'm sorry. Yes, sir.
Other than going to the doctor and all that, is it avoidable or do it just pop up?
So, when we talk about avoidable, none of us can avoid cancer. We're all at risk for some type of cancer, okay? Eating healthy, exercising, doing all those good things that we know that we should be doing, those are the things that help reduce our risk. If you know your family's history, that also helps to give the doctors a heads up as to what we should be looking for. If your dad had prostate cancer or lung cancer or any other type of cancer or heart disease, we need to know those things because that helps us better take care of you because that tells us what your risk is. If your mom had breast cancer, if your mom had lung cancer, if she was a smoker, if you're a smoker, if you were inhaling a lot of secondhand smoke growing up but you never smoked. So we need to know these things to help better take care of you. I hope that answers your question. Did it? But tell me, you still look like you have a little question in the eye.
No, I'm just thinking, this is my thinking place.
Any other questions? Yes, ma'am.
If young girls develop and grow, what should they go to the doctor to be examined by the gynecologist?
And so, unless that young lady is sexually active, they should still keep up with their regular appointments, just like they were when they were, from age 0 to 10 and 12. They should still be going in for those annuals and for those school physicals. But annuals mean different things for different genders and ages. And so most of the CDC and others are recommending now age 21 for the first pap smear, because they begin to be at risk for cervical cancer after sexual activity. So and please, we've had parents that bring their daughters in and they want to be checked to see if they're still a virgin. There's no such test.
I thought it was.
Talk with your kids. I talk with both of I have a daughter and a son. And I've had very candid conversations with them. And I don't know what it is about that conversation that turns parents into something else. I don't know. But we need to be realistic. You know what you were doing at that age. So I mean,
I'm a good girl, Dr.
I know you are. But let's be real, okay? So, in getting back to your question, okay? I ask parents to have real conversations with their children. I'm not doing a pap smear on someone until they're 21 years of age, unless they disclose to me that they're sexually active and they would like to have one. We need to, as families, be strong and have those conversations with our children before we get into the doctor's office scrapping with them. And I don't want to see that, but sometimes I do, because parents aren't having those conversations. They're just dragging them to the office, screaming at them. That's not wrong, and that's not the way to do it. So we need to have open and honest conversations. Quit being so squeamish about talking about sex with your children, okay? Stop that. They're human beings. They have feelings. And you need to tell them there's a time and a place and an age for that, and you're not ready for that, and the emotions and the things that go along with that. Our children are being exposed to so many things now, very aggressively through social media and the internet. So we need to get in front of that, the things that we can do as parents and grandparents. So girls, you should start to have those conversations with not just girls, your teenagers, prior to them becoming a teen. I started talking to my children when they were 10 and 11. And so they get comfortable with those conversations. You don't wait until somebody is 16 or 17 and just start yelling at them and say, don't do that. Like, what is that? What is that? That is not a conversation. That is yelling at somebody and putting them down and lowering their self-confidence. So I want my families, my teenagers to come into the office with the confidence that they need to be able to handle the world when somebody is trying to force them to have sex and they don't want to, and they're not ready for that. I hope I answered your question. You got me on the tangent.
Yeah.
Yes, ma'am.
Another question. I was told that if you've always had normal pap smears, they are now saying that the insurance company saying that you can wait 5 years to get your pap smear. Now, I've changed 2 doctors because of this. And the reason is because I have breast cancer too, but I have cancer that runs in my family. So if I'm a person that knows that my family or I can be at high risk, why are the doctors denying, because I've had abnormal pap smears, why are they denying to give me a pap smear even if I'm trying to stay in a preventive state?
Are you trying to get an annual pap smear?
Yes.
Yeah, it's going to be very challenging and difficult if you haven't had an abnormal pap smear, recent abnormal pap smear.
But you have cancer that runs in your family. Yeah. My dad had it, my mom, my grandmother, my grandfather. Actually, I got a sister who had breast cancer. I got a sister right now that's going through it, stage 4. So you're trying to be on the preventive side. Why are they denying you that?
No, I get it. I get it. And the insurance company, here go Chelsea, about the insurance.
Here we go.
You know, really, we have to be advocates for our own health. And there are people at your insurance company that are specifically hired to hear your story and the reason why you feel like you need to have an annual pap smear versus going every 3 to 5 years, because that is the new recommendation now. And of course, when it came out, everybody, all insurance companies jumped over and said that's all we're paying for unless you have something abnormal. Now, these are good recommendations. Ours, we do every 3 years. Every 3 years, you get a pap smear unless we need to do it more frequently because that pap smear was abnormal. So that has to be taken up with each individual insurance company, being an advocate for yourself and speaking to the person who is assigned to that insurance company as the patient advocate person at that company to give your argument and your reason why you feel like you should have to be allowed to have an annual screening. Don't think just because you can, here, go ahead, Chelsea, because you pay a premium every month that you can walk into the doctor's office and order, have the doctor order all these different special tests. There has to be a diagnosis tied to each test. And if it's not, it's going to get thrown out and rejected. Abnormal pap smear. Need more frequent pap smears. Every 6 months, once a year. That will get paid for. No abnormal pap smear done annually, that's going to be the patient's responsibility. You can get it, but you'll pay for it.
I mean, but why would they deny you then? If you got to pay for it, they should tell you that.
Yeah, they should tell you up front that we can do this screening, but you're going to have to pay for it.
I've changed doctors 3 times because they telling me this. And if I want to have a pap smear, I should be allowed to have a pap smear. Tell me that I will have to pay for it. Don't tell me insurance is not going to pay for it. I don't care if insurance is not going to pay for it. I know my risks that are involved.
No, I hear you. So, patient advocate at the insurance company, and if they still say no, then you find out up front how much the charge is going to be for a pap smear, and then you go in there armed and with your mind knowing that you're going to get a bill for this service.
Yeah.
So the office visit may be covered, but the service of pap smear probably would not be covered, and the lab's reading of the pap smear. That would all be on the patient responsibility. When you get your EOB, it'll tell you office visit covered, and then those other 2 services won't be covered, and they'll say patient responsibility.
Yeah, but for them to just deny you and say that's not right.
I know. Yes, sir.
How likely is it for a survivor to, after chemo and radiation therapy, to have neuropathy?
It depends on what chemotherapy medication you were given. There are certain chemotherapy medications that go straight to the nerve cell. They kill the cancer, but they also take the sheath off the nerve, almost like a diabetic neuropathy. And so it's the medications that literally do that. Not so much radiation, more so the chemotherapy medications. But it can occur in more intensity when you're getting chemo and radiation, particularly radiation to that specific area.
And,
answer some good questions. Yes, sir.
This may be a little controversial, but I mean, this is new medical research that they're seeing a lot of medical benefits with like ketamine therapy, and I was curious, what are your thoughts on that?
I think that ketamine therapy is potentially beneficial, but outside of a doctor's care who is experienced with that treatment therapy, and there need to be strict controls and guidelines. We all know what happened to the actor over the summer. He had been going in for, he's a drug addict, so he's been going in for the ketamine therapy, but then buying off-market ketamine and taking higher doses of it. So his treatment of the normal ketamine regimen was not going to even work on him, and that's why he needed to keep getting higher and higher doses. So when it's out of control and out of a medical professional's control, and unfortunately he had doctors that were doing that stuff. Unseemly doctors who were routing around the actual accepted treatment regimen. And I still think that a lot of research needs to be done on ketamine, and tight controls need to be done if it is going to be administered, because it's very dangerous. Can kill it. That's what's up.
What are the advantages and disadvantages of hormonal therapy?
And so and we talked about that. So there are hormonal medications that are used to treat cancer, particularly breast cancer. And so those hormonal medications will latch onto the receptors of the cancer cells and help to kill those cancer cells. When we talked about triple negative cancer means that you don't have the receptor cells, so there's nothing for the medication to latch onto, and those cancers are more difficult to treat. But the hormonal therapies include tamoxifen, which is an oral chemotherapy medication. All right. If we don't have anything else, I think I can give you guys back a few minutes of your time. I certainly appreciate it. I see you were eating one of my favorites. I love those salads. So you at least ate healthy today. At least I hope most of you did. So take care and thank you all so much.